Well, if we were starting a program for high school in terms of concussion management, most importantly would be a baseline assessment. The baseline assessment, as the neurologic, would include a symptom checklist, as what symptoms the individual has or doesn't have at baseline, would involve a neurologic assessment in which vision, eye tracking should be a part of it, balance testing using the balance error scoring system or some other balance testing should be a part of it, as well as a cursory neurologic exam. If you wanted to have neuropsychological testing be done, I have no problem at all with that. That's perfectly fine. That's great. But understand that it's the cognitive part of the neurologic exam that's replacing. It's not replacing the eye tracking, or it's not replacing the balance part of the neurologic exam. And then when an individual is suspected of possibly having a concussion, they need to be withheld from play until medical personnel has examined them and compared their current exam with their baseline exam. It's very uncommon. Roughly only half the high schools, public high schools, have certified athletic trainers. And most of the high schools do not yet still have comprehensive baseline testing. Unfortunately, some of them are using impact testing and thinking that that's the whole test. That's all you need to do. And although the people from impact will tell you, use it as a cognitive exam, don't use it as all the tools in your toolbox, unfortunately it's being used that way in a number of high schools still. The negative of using it as a comprehensive red light, green light is that you can pass the cognitive part in some instances and still have balance symptoms or signs, still have visual deficits, and not have recovered from your concussion based on that. And yet if you only use the neurocognitive assessment part, you can falsely think that you've recovered, and you can be allowed to go back in while still symptomatic from other parts of the brain. I'm aware, without question, that not just Peyton Manning, but athletes at all levels sandbag their baseline testing. And you have to do the best you can to be sure you're getting the most maximum response from the athlete. Sometimes it's not the athlete's fault. Sometimes the baseline testing is given in a not quiet environment, or an environment with too many people, or doors opening or closing for distraction, or sometimes given after the athlete, for one reason or another, whether it be an emotional problem or whether it have been up late all night, that kind of thing, is just really in no condition to take a baseline assessment.